Assalamu alaikum, everyone. Very happy to be with you today. I'm not a dermatologist, I'm a plastic surgeon. I'm going to speak about face and neck thread lifts. And I'm very happy to be here because I have 3 dermatologists in my family, my father, my cousin, and also my uncle. I don't know if you know this guy, he's quite famous. He's my father, he's my uncle. He's the expert in France for surgical dermatology. So I'm very happy to be here. I'm a plastic surgeon, even if I do a lot of facelift. When I moved from Paris to Dubai 5 years ago, my rate of facelift per month dropped down from 1 or 2 per week. Now it's 1 or 2 per month because I believe the population is younger in Dubai. I was in Paris last week, and I can confirm the population of France is much older than in Dubai. So what to do to this patient around 40 if they don't want a facelift or if they are too young for a facelift? We have this option, the thread lift. And we can do it for the jawline, the mid-face, the upper face, and also the nose. So thread lifts are quite ubiquitous. So I'm going to speak about Aptos thread, but it's not a commercial lecture. I'm not paid by Aptos. But I strongly believe when it comes to thread, thread comes with a method. So you cannot speak about a method if you don't speak about the thread, and vice versa. It's not like fillers that are changeable. So I will mention Aptos many times, but again, no disclosure to disclose. My main disclosure is actually I'm an anatomist. I run the Dubai Anatomy, and the next course will be in 3 weeks. Dubai Anatomy, you are more than welcome. So let's talk about the thread. And first of all, what is ActaPro? ActaPro is my acronym for all my patients, non-surgical, surgical, to decrease my complication and to increase my outcome. A stands for anatomy, clinical indication. This is a patient selection. It's very important when it comes to thread because thread actually are not for everyone. It's a much more limited field than fillers, for example. Technique, but I believe it's not the most important. Art, you need artistic touch. Good products, of course, respect, as we say, don't overfill, don't over-tight, and good follow-up observation. So this is nothing else than acting as a professional. Anatomy first. We know that we age in 3D, not only in gravity. So when it comes to treat the ptosis of the tissue, we cannot really treat that with filler. I'm always a bit surprised with this non-surgical, liquid facelift. I don't believe fillers are lifting. I think they give the illusion of lifting, but they are not really lifting. So I much more believe in the combination of thread that can lift and fillers that can fill. So you can treat the brown arrows with threads, like, for example, in the jawline, you can do a thread to pull up the tissue, but also some filler, for example, in the prejaw sulcus. So I believe in combination. Okay, this is something that came up during COVID. Like everyone, I had a lot of time to brainstorm, and I was having this concept of Adidas face, looking at this patient. She's a Parisian model, and she has these 3 lines, eyebrow, cheekbone, jawline, very parallel upward. And as we age, we lose these 3 vectors. And by the way, with the thread, we can treat all the stage, all the floor of the face. But I do it from bottom to the top, not like in the fillers where I go from top to bottom. So this is important to explain to the patient that we ideally we need to treat the whole face. So as I said, I start in the jawline and neck, and then like if I were climbing the stairs, I'm going up. In fillers, I start by forehead, temple, and I go down. But for thread, I think this is better to do the contrary. Like we do in surgery, I personally do the neck lift, then the jawline, then the mid-face, then the temporal lift. Regarding the anatomy, it's quite simple. We know the 5 layers. I will say 99% of the thread should be in the layer number 2. I will tell you why I don't say 100%. We have superficial fat compartments, deep fat compartments. Very often, I put the filler deep and the thread superficial. So if we apply these layers to our technique, non-surgical technique, as I said, thread in the layer 2. For fillers, we can do deep, superficial, or even intradermal, so 4 to 1, and toxin, we target the muscle in the layer number 3. So for the thread, 99%, layer 2. Why? Because in some area, for example, when I do a brow lift, or when I do neck lift, I do an anchorage, a deep anchorage here in the galea or here in the mastoid fascia, but only on the one point, not on the long course of the thread. Superficial fat is the field for the thread. We have superficial fat everywhere except in the eyelid, at least in Caucasian eyelid. But it's important to notice the difference of this fat in thickness, in also composition. You see, for example, there is a yellow fat in the cheek and a white fat in the perioral area. Also, it's quite thick in the cheek, quite thin here in the temple. So we need to know all this difference. But superficial fat is definitely where we need to put the thread. There are different compartments. The medial compartment, this is like a column, which is ptotic, is going to be the target, and the lateral cheek, which is more stable because the retinaculum cutis is more dense, is going to be the fixation. So we have different compartments, but at the end, we just need to know that we have a medial column and lateral cheek. Also important point, when we put thread, shall we go beyond the fold, beyond the nasolabial fold, the marionette fold? Actually, no, because when we go in the perioral area, the fat is white, sorry. It's fibroadipose fat, so we cannot lift that. So basically, if we go for the mid-face, for example, here, we stop at the last cone or the last bob, should be just before the fold here. Very important, as I said, the thickness. So, of course, when it comes to the cheek, it's quite thick, temple much less. And you always need to adapt with the pinch test the depth of your thread, because if you go from the temple to the mid-face, if you are 5 millimeter deep in the cheek, it's okay, but 5 millimeter deep in the temple, it's not okay. You will be too deep, maybe injuring an artery or a nerve. So you always need to be something like halfway between the skin and the SMAS. There are some variation. If you go very close to the skin, you are going to flatten the tissue. So you can do that, for example, in the fold, nasolabial fold, marionette fold. And if you want to volumize, you are going to be a little bit deeper. We do that for the mid-face. So it's not just, halfway. You can go you can play a little bit, being a little bit more superficial and a little bit more deep. And with the same thread, like, a dolphin, you can adjust your depth. So it's a very meticulous technique. SMAS is a no-go zone because we have the vessels. SMAS invented by Mitz from France. He invented that for the facelift, for the surgical facelift. But now, SMAS is everywhere. For the thread, basically, this is the limit, the deep limit. You don't want to go below. The deep fat, as I said, you should not go there with thread, but sometimes you can combine with deep filler. You see here, subsmas in the cheek. No way you go there with a thread because there are nerves, so it's not safe, and there are ligaments, so it's not efficient. So for both safety and efficacy, no need to go deep. Then we have the ligaments that are from the skin to the bone. Again, if you look on the left, you can imagine that only the top of the ligament is going to move. It's like a tree with the wind. The trunk is not moving. The branch are moving. So you put your thread close to the skin. Where are the small, small fibers of these ligaments? So again, 99% of the thread in the layer number 2. Now, let's speak about the thread themselves. There are thousands of threads, and I'm going to speak first of all to the jawline. And when I do the jawline, I always do the lower face and the upper neck together, because if you want to highlight the line, you should basically play on both sides. So basically here, the superficial fat is quite thick. You evaluate it with a pinch test, something like 8-10 millimeter. The platysma is the lower, the deep border. And as mentioned by Maria Qatar before, of course, many of the problems in the neck are deep. And we cannot treat everything targeting the superficial fat. Very often the deep fat, the digastric, the submandibular gland are also involved in this heavy neck. So we have to explain that to the patient. Here you see this is the interdigastric fat. You cannot do that. You cannot go that with thread, only with surgery, submental approach. So you see here in the neck, you have these 3 fat, superficial, where you put your thread or your lipolytic or whatever, then subplatysmal, then interdigastric. So 3 layers of fat, and again, you can't go deep, you go only superficial. So we have different types of thread. I'm going to go fast to save some time, but I cannot fast forward. I'm going to save a bit of time. So you see it's a monodirectional thread. The thread is loaded in the cannula, and you go back and forth again in the superficial fat. you always need to control the depth by some movement, lateral movement, elevation. And here you have 10, so you put 5 on each side. And very important, you put the patient in a laying down position, because when we are laying down, we are always, elevating our tissue. That's why girls, they like to take selfie in the bed, because they are actually lifting the tissue. They look younger. And then you position the thread. You don't pull, you just put the thread and you position the tissue on the thread. So I never pull a thread. I put the thread and then click, 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 click. I position the tissue like if I were climbing the stairs. Okay, so some results that are coming from Aptos collection, but again, it's not commercial, just to show you some elements. You see, I think it's important to explain to the patient, you cannot treat the jaw just with filler by putting pre-jaw, post-jaw angle, otherwise you are going to masculinize, a woman patient. Another types of thread now with double needle and double direction, so you have different anatomy of thread. I speak about face anatomy, but we could speak also about thread anatomy. Here you see double direction with opposite direction of the two branches of the thread, and this is quite strong, stronger than the last one, than the previous one. And they are different, of course, thread with the same pattern, but I'm speaking about only what I do since 5 years, this Aptos one. This one is for the user, thread to G. Okay. There is another one, even more powerful, needle to G, which is longer, which is for the neck. And you go from one mastoid to the other, like, a necklace, like a hammock. This one is very powerful, a little bit more, a bit longer learning curve. And I use it also for the eyebrow. So this one is really a surgical one. But again, thread are for everyone. Even if you are not a surgeon, you can do the thread, of course. But this one, definitely, you need to be very meticulous, because it's less forgiving. You can have more indentation, etc. But this is very powerful. As a plastic surgeon, I use only this one, because, patients coming to a surgeon, they want something more significant, more radical. So you go with one from left to right, and the other one from right to left. All right, the same on the other side. I'm going to skip that, and you have nice result. But again, it's not for everyone. Sometimes when there is a heavy neck, you can do that. It's more for skinny neck, where the skin and the superficial fat laxity are the main problem. All right, so this is the first stage, the jawline with lower face and neck. Now let's come up and let's go to the mid-face. So for the mid-face, what is important is the lid-cheek junction. We have fat in the cheek. We don't have fat in the eyelid. So you see red, yellow zone. The thread should be, of course, in the yellow. No way you can put a thread in the eyelid, otherwise you are going to create edema. So you have a good amount of fat here. And as I said before, if you want to volumize a little bit at the same time, you can go a little bit deeper. Always above the mass, but a little bit deeper. So you can recruit some tissue and give some projection. So we are going usually from the hairline, from the temple, to the nasolabial and to the marionette, which are the main target. Again, some compartments. So you see nasolabial and medial cheek fat compartments are the target. We are above the mass, of course, and not below the mass. Again, not efficient, not safe. But you see here, below the mass, we have some deep fat compartments, so we can eventually put some deep filler, especially in the mid-face. You don't want to go superficial. So you can go deep filler, you can put deep mid-face filler, and superficial thread. So there are some different thread again. As you saw in the neck, we can use the same monodirectional thread. It's a cannula, loaded, so you go from the pretragal region up to the, you can treat a little bit also the jaw, the marionette, the nasolabial, and then you can go up with another entry point a little bit higher in the sideburn and target more the mid-face, the cheekbone area. I wanted to fast forward, but it's not possible. I have again 1 minute, so I'm going to go faster, but basically this is the same than you saw before. Just one direction, but the thread is quite long, 19 centimeters, so you can do 2 or 3 passes. Of course, you don't want to waste your material, so you can use it. So here, just to save time, I'm going to, if I have one thread for the mid-face, I will be happy to show you. Yes, so you see here, this is a higher entry point, and we go in the midface up to the nasolabial, but not beyond the nasolabial. All right, so some result, you can create, a more V shape. So you lift, but also you volumize the cheekbone. I will finish by the brow. So with the COVID and mask wearing, it's quite popular. If there are many surgical techniques, and here, basically, in terms of anatomy, everything is more dangerous. The fat is thinner. There is nerve. There is artery with risk of palsy, risk of hematoma. I'm going to conclude, Dr. Gian. I'm running fast. And the artery is a big problem. I always infiltrate with adrenaline. It's very important to infiltrate with lido plus adre to have hydrodissection and vasoconstriction, because here the risk is the hematoma. And you don't go below the SMAS because you have the nerve, so risk of palsy. So be careful with thread in the brow because it can be a little bit dangerous. And you see here, before this Aptos, I was using one with cone. Cone are palpable here. So the choice of the thread is important. So, Dr. Gian, you want me to conclude or you give me 1 minute? 1 minute is fine? Okay. So just because I think female doctor will enjoy this brow thread lift, but basically you go 5 centimeters above the eyebrow. You have different thread, monodirectional, bidirectional, but the most important is the depth. Again, here, the fat between the skin and the SMAS is quite nothing. In skinny patient like me, you have 2 millimeters, which is quite big, okay? So this is one. It's quite subtle. I'm going to speed that. And just to show you this last one, because this is the one I show you for the neck, that I use also for the eyebrow. It's a long 150 centimeter, and I do some loops, some V, and I do a lot. So it's quite efficient, very strong, and but not easy. So this one, you really need a good learning curve to practice. Maybe before, first of all, in cadavers, then to show, to see a KOL, and then to try it on patient. But the risk of indentation is quite high. Okay, and then you turn over with this special needle. You don't need to go out, like if you are, sewing tissue, like haute couture. You can go back like this, and you make some loops. So because I'm running late, I'm going to skip the nose, but you can also do it in the nose, just to let you know. For the nose, you can't go superficial. So when I say 99% layer 2, it's also because in the nose, you cannot go superficial. It's too thin. So in the nose, you go as deep as possible. And this is interesting because you can lift, but you can also project. If you do like this, tick, 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 you can give us also some dorsal augmentation. So I am sorry I cannot fast forward. If you just let me see this, because I think it's quite interesting. We said before the risk of fillers is skin necrosis and even blindness. Well, with thread, you cannot have necrosis and you cannot blind your patient. So this is quite interesting. No option, I think, especially, with this Aptos thread that are very efficient because it's not PDO. It's, I didn't say that it's PLLA, PCL, and hyaluronic acid. It gives a long-lasting result, not 1 month, but up to 1 year. So again, as a surgeon, for me, it's quite important because I cannot, afford to have 1 week or 1 month result. Thank you. So I'm going to conclude. You see the result here, elevation of the tip. All right, tac, tac. So this is the end of this presentation. Remember the Acta Pro. This is my conclusion. You can take a screenshot if you want. And again, welcome in 3 weeks to Dubai Anatomy. Shukran.
Thank you.